Hi, this is Dr. Mike Verzilchak, and what you're about to see is baby Genevieve having her very first chiropractic checkup and chiropractic adjustment. The audio quality on the original video was too distant, so we had to record over it, but I'll dictate as we go through. Now, Genevieve came into the world just 10 days ago, and her mother, Deja, is an active practice member in our office. And Deja, throughout her pregnancy, was adjusted as a way to stay comfortable and to make sure that her internal environment was optimal for growth and development of her baby. So now Deja brought baby Genevieve in to be checked, which is a very proactive and preventative way to make sure that children grow up strong, healthy, and fully vibrant. Now, Genevieve came into the world without any complications. The pregnancy and delivery went great. Her in utero presentation was balanced and in a vertex position, which allows for a very smooth delivery. And oftentimes when we're evaluating patients and babies, we want to make sure that there's no history of trauma or stress during labor and delivery. So what I'm about to do is place the baby comfortably on her mommy's tummy. Since we're trying to access her spine, Deja's lying comfortably, and we'll position Genevieve in a face-down position. And then I'm going to make my way over to the other side of the table where we could begin evaluating her. What we're looking at is a lot of things: spinal tone, spinal symmetry, and making sure that the individual segments of her spine are moving. Now I'm going to start at the base of her spine and check for muscle tension and muscle tone. And the area that I'm applying pressure to now is just testing the nerves that go to your lower GI tract. As babies, one of the common things that we see is colic, digestive issues, acid reflux is becoming more and more prevalent, and so the neurospinal integrity in the lower region of the spine is very important to be checked and maintained. Now, in addition, children have a lot of reflexes that are needed to be screened, and Genevieve passed all of those with flying colors. Now, the pressure that I'm applying to her spine is extremely light and extremely sensitive. It's literally no more. If you were to take the pads of your thumbs and press lightly into a tomato to see if it was ripe, that's exactly how much pressure that is being applied right now. And so I'm looking at her entire body for symmetry and balance. And now I'm making my way up to the middle spine, which is very important from a structural standpoint because the nerves that exit from that region are the ones that supply your heart and your lungs. And commonly, children more and more are developing asthma, and chiropractic has great results in children with asthma, and it's by taking stress off the nerves in the upper spine. In particular, it allows for maximized nerve supply to your lungs and to your bronchial passages. Now, Genevieve did have a very mild restriction in her spine in that region, so just using the pads of my fingers and applying very, very light pressure, I was able to make an adjustment and clear out that pathway. Now what you'll notice is that in just a second, Genevieve is going to, Deja's going to sit up, and I'm going to check Genevieve from a seated position. Right now I'm just looking at her neck while she's face down, and gravity is not part of the equation. And then when we sit up, we want to see how her muscle tone changes when she is in an upright weight-bearing position. So we'll help Deja up off the table, and now she'll place Genevieve on her shoulder. We'll check her that way. Now, the structural integrity of the upper spine is very delicate and in the newborn state. And so it's very important to make sure as parents you screen for symmetry, and when children are lying down, make sure that their head isn't favoring one side or the other, or if you're breastfeeding, that the child isn't partial to one side or the other, which often indicates that there's a restriction or increased muscle tension on one side versus the other. And I just asked Deja if she had noticed anything in terms of head position or muscle tone, and she said no. So I'm just going to gently palpate Genevieve's neck. The whole time she's being so good not crying or fussing at all, and even cracking a few smiles. Now I'm just, again, supporting her head and gently with the pads of my pinkies looking for muscle tone and tension. Now I'm just checking to see if her atlas vertebrae, the very top area of her neck, is aligned and moving properly. And what I'm actually noticing is that there's a slight malposition to the left. And so using my pinky, just applying light pressure, gently stimulating and sliding that atlas vertebrae, which is so important from a health standpoint, because that's what protects your brainstem, and that's where all the neurological connections in the body go through. So Genevieve just had her very first adjustment. She is now all clear and is healthier than 99% of all the babies on the planet. It was safe, gentle, and she is off to a very good start. So we're proud of Deja,